demand for expanding the scope of vaccination is coming from several quarters. Many states have put that demand forward to the central government that they want to give more of their citizens vaccines rather than just the stipulated recipients right now, which is all of those who are 45 years and above. Another important constituency which has asked for the expansion of vaccines is the Indian Medical Association, that wrote a letter to the Prime Minister this week asking that all adults above the age of 18 be allowed to be vaccinated if they so wish. This comes at a time when there are reports and claims and counterclaims of a vaccine shortage in the country. To understand more about this demand and how the second wave of COVID-19 that has hit India currently is different from the first one, I am joined by the National President of the Indian Medical Association, Dr. Jayalal. Dr. Jayalal, thank you so much for speaking with us here at ET Now. Let me begin with your demand to increase the scope of vaccination to all of those above 18. Now that we're hearing of shortages of vaccines, many states are reporting that some centers have halted their vaccine program because they don't have enough vaccines. Is it even feasible to want the vaccination of all of those above 18 years, at least for some time?
Yeah, thank you for this. But you must always realize that government cannot take a decision like that. When there is so many people are coming, there will not be any way to vaccinate the people. You look at the condition. When we said for the 3 crores of the frontline workers are to be vaccinated, it took almost a 1 month time for us to get it done. It will not happen in one day. They will take their own time. The takers will be less, and they will be coming in a very short. But since we are in a position of a pandemic surge, we cannot take that chance. We need to go aggressively and vaccinate the maximum possible people. And to do that, an aggressive and maximum coverage, this strategic division of age group is going to be a great hindrance for that. We are not saying that if there is no second wave is there and if there is no second surge is there, government would have gone on that the same strategic way. But at this time, with that pandemic is at the peak, and pandemic is the only option in our hand is only the vaccination. Government should change this plan of action, and aggressive vaccination shall be the role. And if there is a shortage, and there must be some means and ways to be created so that we will be able to get more or open up for the new vaccine to come into the India so that we will be able to get an adequate stock. Let us, with the practicality, with that that's on fear, and let us not withhold the vaccine. Another complaint which the government always get is a vaccine wastage. Why it is happening? You open the 10-dose vial, and if the people under about 45 is not coming, 2 to 3 doses are getting wasted. And instead of wasting that doses, why don't you allow it to open to the people who are any age group and get that vaccination? So the strategy should change. Strategy should be focused on maximum doses. We need to cover at least 30 to 35 crores of people within 2-3 months to achieve our aim of getting a herd immunity in this country.
So, when you ask the Health Ministry about this, and journalists have been asking the Health Ministry about this at their briefings, they're very clear that the aim of the vaccination program is to protect lives, not necessarily cover everyone and create herd immunity. That's not the goal and purpose. They've said that vaccines have to be given to those who need it, not those who want it. And the data so far shows that those above the age of 45, and especially those with comorbidities, are more likely to die of COVID-19. Now, what do you say to that? Doesn't it seem pretty logical that you will first cover all those who require it and are more likely to meet with a fatality because of COVID-19, rather than aim at immunizing more people so that the economy opens up, etc.?
I do not understand the concept between those who need and those who like, and nobody like any drug. If they like it, they take it because of there is a need. Secondly, it is true with the sense when the government of India is saying that we are aiming at the protection of the life, and the fatality rate or the mortality rate is the criteria. In the first wave, when the corona was striking our country, that is definitely that was the playing level. But today, if you see the second wave, how it is creating, it is affecting mainly the younger age group. That has been scientifically proved by ICMR and all the studies, that younger age group of people. And the most importantly, the younger age group people are the super spreaders. See, when a man of 70 years old is getting the disease, he will not compute here and there. Most of the time, they get isolated. The disease was also isolated into the place. But now, since the younger age group, the more people are getting, they are traveling here and there. There is no restriction for them, and they are playing the spot of super spreaders. Some of the schools, some of the colleges where the students were allowed, some of the mass medias where the people were coming, they were the super spreaders. So, what is our objective in a second wave of the spread? The spread has to be curtailed. Today, our mortality is 0.5 percentage, 0.6 percentage. That is not a significant mortality we have. But we need to curtail the spread of the disease. How do you get the spread of the disease? The only option is having a herd immunity. Thereby, 60 to 70% of our population has to get the herd immunity. See, if you see the total, the population above 18 percentage in this country is only 55 percentage. If you see 100 people, the people who are above 18 percentage, only 55 percentage of people. And there is most of our people is younger generation, less than 18. We are not talking about that. We are saying that, and people who is above 18, who are moving around, who are working in the factories, working in the industries, where they are working as a various way, those are the people who are the potential spreaders, and the vaccination drive should be focused on them, and they are the to do that for the country, not maybe not individual. It is for the country we need to do that vaccination for them.
No, but then, the other counter argument to that, Dr. Jayalal, and let me play devil's advocate here, is that how do you ensure the vaccine is then distributed equitably? If you open it for all, and we clearly do not have the wherewithal to vaccinate everyone. I had a conversation with Adar Poonawala earlier this week, and he said, do we have vaccines to vaccinate everyone? Absolutely not. So the vaccines are not there. That will cause a scarcity, and it's very likely that those with more means will be able to corner the vaccines. That's the fear, that we have to ensure equitable distribution first, because it is a finite resource.
Yes, I fully agree with you. And every time the distribution is equitable, that is what is the equitable distribution? Everyone who is in a danger of spreading the disease has to be infected. Not that we are, see, what is the, if you say the mortality, what is the mortality? If the 100 people are infected, only 0.5 percentage of the people are getting mortality. That means you are going to find out by the philosophical means who is going to die, and then only for them we are going to give the drug. It is not so. That is not the way. Equitable means you open it up. How long time it take for us to 8 crores people to be get vaccinated from January 16th, and today almost 3 months has gone for us to get vaccinated 8 crores of people. That is the only target we have achieved. But what is the target set by the government of India? They said from June end they should target 35 crores of people should be vaccinated. It is not the target which is set today. It is a target set much earlier. And for reaching that 35 crores, and how you are going to do that? And that another 2 months is time which is there for us to get it done. If there is a people above 45 is not coming forward and getting the vaccination, what are you going to waste the time? Is it the time to wait for that, the things to let everyone at their convenience come out of the home and get it vaccinated? You go aggressively for 1 week or 10 days, that everyone above 45 years should come and take the vaccination by this time, and finish that. And after that, quickly open it for all other people. If the government needs time, yes, they can take time. I'm not saying that in a single day you need to do that. It must be done in a phased way, say for the 45 years, and next day you can say for the 35 years. So, but that has to be done in a way, aggressive way, not at the pace and way in which the people like or people want to come. See, now, even after 45 years is open up, what is the way? We are able to spend only 40 lakhs to 45 lakhs per day. And the government of India has already agreed that the monthly production of the vaccine is somewhere around 8 crores can be done. There is a Poonawala at this Serum Institute alone can produce a 6 crore of vaccine. The COVAX can produce another 2.7 crores of vaccine. So we have 8.7 crores of vaccine can be produced per month. And if we are going in this speed, and we will not be able to reach that, if we are going to restrict that. So let us be an active role. Those who are interested, please walk in to private or public health center, get vaccinated. and see, the restriction is going to be there for next 1 month probably. After that, definitely the new vaccines will come into India. There is a Sputnik, the research is going on, already it has been used in Russia. Indian government is also conducting the research. Anytime they can open up Sputnik, so there is another bulk of vaccine is going to come. There are other 4-5 companies are now on the trial, and they will be bringing out within 1 month. I am sure there is a few more vaccines are coming to come into that. So definitely anticipating that more vaccines will come, export will be reduced, and more infrastructure, our production capacity will be increased, and we should target for that, and we shall not be able to wait for that. How long it is going to be wait? Already my country 1.25 crores people are already 1.25 lakhs of people are infecting getting daily. There is no beds in most of the places. And can we now say the logic and strategy is more important than opening it and making it in an aggressive way, in a war footing it has to be done? My appeal on behalf of Indian Medical Association to the government, let us play a major role in the vaccination. Yes, mask plays a major role. We need to 100% concentrate in promoting the mask. But equally, we should also promote the vaccination, irrespective of the age group, irrespective of the situation where they work. I wholeheartedly welcome the move of the government of India to make vaccination at industries and working place. Suppose you are going to industry, then are you going to vaccinate only the people up to the 45 years? Then vaccinating people up to 45 years and leaving behind all those people without 45 years, less than 45 years not vaccinated, what is the purpose we are going to achieve? If you are going to a country or a factory which has 100 workers, all of them has to be vaccinated. All of them has to be advised to take the mask. Then only the objective of preventing this disease from spreading will be able to achieve.
Okay, let me talk to you now about what we're seeing in the second wave. There is a variety of inputs coming in about how the second wave is different from the first wave. 2 points that people are talking about. One, that younger people are getting the COVID-19 this time around, and second, more children are being impacted as well. Are you seeing this? Are your doctors seeing this?
Yes, absolutely. What the demographic pattern we are seeing is there is a change in the pattern. There is a more and more younger people are getting. The more and more people are getting into a drastic deteriorating conditions all of a sudden, and the symptoms pattern of presentation is also differing. Some people are even coming to presentation without even the fever. They are coming into that. So this it is in because mainly it is because of the mutation happened in the virus. The presentation pattern is also changing. So that we are aware and we are conscious. But one good thing on everything is the medical fraternity is prepared to tackle this crisis with a very formidable way. We know for sure now who needs and what kind of treatment, and what are the specialty drugs has to be used, and in what position, whether he needs just an oxygen or whether he has to be put on whether ventilator. All this protocol based medical management is well established. So now there is no difficulty for us in managing the individual, even if they are coming in a complication. Definitely the second wave is more complicated than the first wave disease. But since the medical fraternity and the preparedness and the government infrastructure is adequate enough, we are able to reduce the mortality in this country today.
Now, so is the second wave, how would you describe it now? Because we know that there are mutations. We don't know if it's causing the second wave, but we know that there are mutations. Is it more virulent and less deadlier, or is it more virulent and equally deadlier?
I will say with the clinical experience, it is more virulent and equally deadlier. But if the death rate is less because of the preparedness of the medical fraternity and the protocol, availability of the adequate drugs. That is what I told you. When the patient comes to you with a disease, when we recognize the disease, now we are able to know that and what way we will be able to protect. Our objective aim in the clinical setting is prevent the mortality. So that we are doing. That is why India, even if they have 1.25 lakhs people affected, the mortality is only around 600. But the last year, the first wave, when we had reaching 1 lakh population affected, we had 1,200 people were dead mortality. So now today it is due to the better treatment protocol, but virus per se, I will say not only equal, it is much more deadlier than the first virus what we are getting seen. as we are seeing not only the people with the comorbidity, the people in a younger age group of succumbing to the disease.
All right, that's an important point right there. I also want to get your feedback, Dr. Jayalal, of what we're seeing as sporadic reports from across the country where the cases have spiked. In some places, there are reports of running out of hospital beds or ICU beds. Some places, there are reports of running out of remdesivir, etc. What are the inputs that you are getting from doctors in the IMA?
Yes, indeed. In most of the metropolitan city, or both the private and public health center hospitals, the bed strength is been increasing. We are able to stretch the bed strength, and oxygen supply is also been. Yes, there is an apparent shortage is there at some places, especially in the metropolitan cities like Pune and Mumbai. We see they're getting the bed is little difficult, but it is slowly settling down. Now the government and the private sector is also expanding the bed capacity. I am confident that we will not enter into the disaster because we are prepared for that. There is adequate manpower, adequate infrastructure is there. We will be able to tackle to that need. Now the elective surgeries and elective cases are being simultaneously taken care in the hospitals. But if the stage comes, that is inevitability comes, we may need to stop the elective procedures and routine cases, and they all will be converted into the COVID center. And most of the necessary stretches like ventilator and the manpower is also available. There is an apparent sluggishness because there is a rapid surge is there, so there is an apparent deficiency. I believe that we will be in a short time, we will be overcome this and settle this issue.
Okay, last question, Dr. Jayalal. It seems like COVID is very selective about where it wants to surge and spread. We're seeing the most number of cases coming from Maharashtra, now Punjab, and a few other states as well, while the eastern part of the country is where polling is going on seem very less affected by COVID. Why do you think that is?
I don't think it is the virus has no preference for that, and maybe the atmosphere with this, the crowding, the protection which the people are taking, and the vaccination which they have taken, and the previous conditions of their immunity level, all this plays a major role in. But we know for sure what causes the disease, how the disease is more spread, and we should not in a disease when we are describing, we should not wonder why he is not getting the disease. I must only look and why I am getting the disease, and I should find some reason to overcome that. And one of the reasons we know it is a vaccination.
No, but the question is that why is Maharashtra, sir, in your medical opinion, why is Maharashtra seeing this largest spread? Is it a function of governance? Is it a function of more testing? Surely there can't be geographical reasons why one state would have more COVID cases than another.
No, it is a true for any time, any pandemic when you take, that is a true. It is not though we call it a pandemic, there is a localization of the virus and the mutation which is happening in that virus at the local areas. We are not saying that though if we say it is a coronavirus, it is not a single virus. There is multiple variant of this virus is there. And some areas the virus may be more virulent and spreading fast. So that is the one reason. Second reason is a congestion which is happening. Mumbai is always a metropolitan, the highest number of the congestion and the travel which is happening. Even if you see today the Mumbai airport, even after so much of death and the corona, still it is congested. People are moving around. So lot of movement is there, and associated COVID appropriate behaviors are not purely ensured. So these are the reasons for the spread of the disease. But now we must also know the mathematics. If there is one person is infected, he can infect another 7%, another 6 people. Now already if you are having 40,000 people are infected, the possibility of the spreading will be more. Comparing for another state. So this is a vicious cycle. Since there is more people, there is more communication is happening. Another very peculiar aspect which we noted in the second wave is, previously it is one or two people in the family will be infected. Now entire family is affected. When the virus is coming, all the 5 people, all the 6 people in the family are affected. So that is also this closeness and is a mathematical propagation model. So it is increasing in state. See, we cannot get complacent on this area. When the first wave started, Kerala is one state where the disease was running in 1 or 2 in the first 2 3 months, then suddenly there is a surge has started after that. So it is in a way which is an unpredictable way it is going on, but we need to be more guarded and gear up us for the masking and vaccination to prevent this disaster becoming a catastrophic in our country.
All right. Thank you so much, Dr. Jayalal, for speaking with us today and answering all of our questions.
Thank you. Thank you.